All right, everybody, good morning. This is Emily Amundsen from DCF. Good to see so many faces. You're not going to see my face today, unfortunately. After having a very healthy fall, I am struggling with the stomach bug today, which is not fun. And so it's days like this where you are so grateful for a wonderful team and for some great planning and for some really, truly wonderful work that we've done as a state. So I didn't lose a lot of sleep over the idea of not being able to host this morning because Erin Arango Escalante, who we all know very well from these meetings, is able to fill in and do a stellar job in my place. I do want to say just at the top, I'm going to be here for the whole meeting, just quiet. But I do want to say I'm so excited about this meeting because this is something this group has been talking about really since the very first meeting of Leadership Council on early years. And so to be able to share and celebrate some of the successes and some of the coalitions that are leading work around connecting workforce with childcare and also sort of collective impact models around community-based solutions for support in that 0 to 5 space. These are things that we've been really hitting on from the start. So excited to be able to share some of that success today with all of you, and excited to have a lot of partners with us today to carry that message and share those stories. So much of this work is about the state, but so much of it is not about the state. And that's what I want folks to take away, that this is really, this has been spurred by state efforts, absolutely, but it's also happening very organically across communities in Wisconsin with the help of some of the great partners that are on the call today. So excited to be able to tell that story. And with that, I'll ask Erin to lead us through roll call and some opening comments. Thanks, Erin.
All right. Thank you, Secretary Amundsen, and I truly hope you feel better soon. I know there's lots of bugs going around. So I'm going to start with roll call, and I'm just going to go through agencies and just let us know who's here. So is there anybody here from the governor's office? How about the First Lady's office?
Here.
All right, I see First Lady Kathy Evers, welcome. DWD.
Here. Morning.
All right, good morning, DHS.
Here.
Good morning, thank you. WEDC.
Hi, Tracy
Yeah.
Luber's on.
And Missy's here.
Great, good morning. DOT. How about DVA?
Good morning, Carlin Peter.
Good morning. DNR. All right, DOR.
Peter Barca, good morning, everyone. Good to be with you.
Good morning. DOA.
Good morning. This is Olivia Huang here on behalf of Secretary Blumenfeld.
Good morning. DOC.
Good morning, everyone. Kevin Carr here.
Good morning. WIDA. DFI. How about DPI? Child Abuse and Neglect Prevention Board.
Good morning.
Good morning. The Office of Children's Mental Health.
Morning, Linda Hall here.
Good morning. And DAPCAP. All right, I think those are all the agencies. Is there anybody I forgot? All right, let's start with our housekeeping just really quickly. So I do need to do approval of the minutes. We shared the draft meeting minutes from August 4th. And we need to approve those minutes. They are in the meeting invite. Would somebody move to approve those minutes?
So move, Peter Barca.
Thank you,
Second, Rebecca Murray.
and thank you, Rebecca. All right, so all in favor?
Aye.
All right, so motion to approve our August 4th meeting minutes passes. Thank you. It is hard to believe that it is our last meeting of 2022. It's gone by so quickly, and it's interesting to think about the work that we've done together in terms of just really connecting the dots on behalf of children and families in Wisconsin. And I think it's important to just start the meeting by just acknowledging the press release that went out yesterday with Department of Workforce Development, and our friends at DWD have been awarded a $15 million competitive grant through the U.S. Department of Labor. And you're going to see so many connections to the work we talk about today to this work in this particular grant. So the grant is known as QUEST, which is for Quality Jobs, Equity, Strategy, Training, Disaster Recovery Grant. And it's really focusing on the partnerships that have been built at the local level as well as the state level. And it's truly focusing on connecting with the workforce. So you're going to hear so many connections to the work of the QUEST grant as you listen to today, both updates on our project growth work, as well as what you're hearing from community members as well. So today we do have a fun-filled agenda with a number of people who are here to speak. We're going to start by sharing a little bit about our Birth Through 5 strategic plan and the work that we've done to date. And then going a little bit deeper into the workforce pieces, specifically on project growth. Both Secretary Amundsen and many of you here, as well as myself, have had the opportunity to do some traveling around the state and talking to our leaders in businesses, childcare providers, community members, parents, so many folks. And they've been talking a lot about some of our partnerships in businesses and the investments that they're making in childcare across the state. We've heard a lot about project growth, both Partner Up and Dream Up, and how it's helping employers hire and retain staff. It's really giving employees a peace of mind on going to work every day, knowing that their children are going to be well cared for. And we're helping children really get off to a great start in just a nurturing, caring, really caring education setting. There's a lot that is happening across the state, and this work is part of a larger puzzle as we continue to really think about the work that we are doing in this space. The larger puzzle is what we're going to start by sharing about, which is that Birth Through 5 strategic plan. It is very exciting work that we've talked a little bit about previously, and really the overarching goal of our Birth to 5 plan is to create a truly collaborative, very ambitious, bold, achievable plan that aligns and strengthens our complex systems that we have in our state. It aligns our services, our supports that are really necessary in building and sustaining a comprehensive and equitable Birth Through 5 strategic plan. So we're going to start again with sharing a little bit more about our strategic plan, and then moving into more about project growth. So here we go. As I mentioned, we are really looking to unite our systems. There's so many, they're complex. Really those systems that inform and co-create our comprehensive Birth to 5 early childhood state system strategic plan. It is huge, it is big, it is robust, and we are doing it in a few different phases. On the first phase, we are developing a Birth to 5 a plan specifically for DCF that connects exactly those birth to 5 programs within our agency that support early care and education. That is what phase 1 is going to be. Phase 1 is going to end at the end of this calendar year. At the same time, we have developed a framework in which phase 1 will live in that is actually going to be carried out in phases 1, 2, and 3. Phase 2 takes that to the next step, and it makes it a little bit larger. So we're being inclusive of DHS and DPI as we think about the larger birth through 5 system, as those agencies absolutely touch our birth through 5 system. They have a number of programs that are housed within that particular system. And then phase 3, which will be done at the end of next calendar year, 2023, will focus on all of the programs that you all represent here. So that larger system that we all connect into. And we're going to start to see how we all connect as we talk more about the work of Project Growth that really started in this space here at our Leadership Council on early years. So there's 3 phases to it. Again, we are finishing up phase 1 at the end of this calendar year, and we'll be done with phase 3 at the end of 2023. On the next slide, you will see here how we are fitting the pieces together. We have met with our colleagues from DPI as well as DHS and DCF and really talked about a North Star. This is our draft North Star for the entire framework that will really be the North Star for all 3 phases. We are interested in focusing on healthy kids, strong families, bright futures, and thriving communities. We, again, are working together in thinking about the population results, specifically those conditions of well-being that are going to really support children, adults, families, and communities in our communities. And so that's something that's we are focusing on right now. And we will have strategies in both phases 1, 2, and 3, excuse me, that are going to guide the work of our agencies. In addition, there will be core values that are the underpinning of our strategies, the results that we want to see, that then lead to the North Star of healthy kids, strong families, bright futures, and thriving communities. We've done some great work so far in collaboration with DPI and DHS, as well as DCF, and we will continue to work with all of the state agencies, stakeholders, those with lived experience, community members, et cetera, to continue to build out the great work of our Birth to 5 strategic plan. So again, just wanted to give you that high level perspective. This will be a topic that we will continue to discuss in 2023 and beyond. So it's very exciting work. All right, and then, so on the next slide, I'm going to just take us a little bit deeper into Project Growth, as this has been, again, as I mentioned, something that you will see in our strategic plan. It really connects the work that we are talking about across so many agencies here. A lot is happening in the communities that we're going to hear about. It's really exciting time, and again, the underpinnings for the Quest grant. So let's get started in Project Growth now. We start, and we've shared these slides here, but I think it's important to just talk about where we are with childcare in Wisconsin. We know that there are working families that need high quality childcare, but what we've found is that many families cannot afford high quality childcare and also struggle to access that care. We also know that programs are not able to charge that true cost of care in order to pay appropriate wages and to cover the costs of providing high quality care. And so what's happening is communities can't maintain the workers. And what's happening also specifically is that they are unable to recruit and retain new businesses, as well as those workers for those businesses, especially women. We're seeing this happen across the state in so many different communities. And it's become a problem. We've talked about it. So many of us have heard stories that are occurring throughout the state. On the next slide, we've talked about how do we reduce and share the cost of high quality local early care and education opportunities that truly meet the needs of family. We've had a lot of conversation about there. In doing so, we are then able to sustain a strong workforce that can attract businesses and communities across the state. We know that this will allow us to keep members of the communities working while their children are safe and learning and growing. We also know that in doing this, that we will generate economic well-being for families, for businesses, and the communities. So as you can see, the importance of childcare is critical at the local level, at the regional level, at the state level. And again, you are going to hear stories today about how this works, how we're really looking at childcare as a solution to some issues that are happening at the community level. And so I want to go a little bit now into some of the details. So on the next slide, you're going to see what we've developed here in terms of project growth. Project growth contains a number of components, and it's based off of a couple of things. I mentioned conversations that we've had here at the Leadership Council on Early Years. It's really rooted in the work that WECA has done in terms of their shared services networks. It's rooted in a lot of conversation with the Department of Workforce Development and Wisconsin Economic Development Corporation. It is essentially a number of components. It starts with our Partner Up grant that we're going to go into more details, as well as our Dream Up grant. But it has two additional components that you will see here, both our business toolkit and our business and childcare advocates that we're going to talk about. But it's this full picture that really is supported in our communities as well as statewide, that's helping us achieve the results that we're going to talk about in the next few slides. So on the next slide, you're going to see our Business Childcare Partnership Toolkit. This was developed in collaboration with WECA, Wisconsin Early Childhood Association, and our partners from the Wisconsin Economic Development Corporation. This is a toolkit that businesses have been asking for. It contains 6 modules that are focusing on building successful partnerships between our business communities and those local regulated childcare programs. So it has 6 modules that go into a lot of detail in why it matters, in building those relationships, best practices, and really how to do this, how to sustain childcare in your community, and really the return on investment. A link to the Childcare Partnership Toolkit has been put in the chat box and can be found on the URL on this slide. We have found that businesses are using this, childcare partners are using it as well, to really think about how to collaborate at the local community level. I know many folks have shared this information and have found it very useful. So this is a part of our strategy that really helps us work together in collaboration with our business community. On the next slide, you're going to see our business childcare advocates. Supporting Families Together Association have been instrumental in helping us develop our business childcare advocates. They are funded through our preschool development grant, and they are housed in our childcare resource and referral agencies across the state. So again, more information on our business childcare advocates can be found on the link in the chat box. But some of our activities of our business childcare advocates include serving as liaisons to build relationships at the local level between businesses and childcare. They are providing very specific technical assistance to our Partner Up awardees, which we'll talk more about. They're holding orientations, outreach events to really think about how to sustain childcare in communities. They are participating in community work groups all throughout the state. They're connecting the dots for folks and recommending opportunities, and they're thinking about how to support future rounds of Dream Up to interested community members, which we'll touch on later on. They're doing a lot of connecting with businesses throughout the state and helping them find childcare. So now we'll talk a little bit more about Partner Up. Partner Up is really doing some great work in connecting childcare and businesses. And this has been an exciting work, again, really born out of the work here and our collaboration in the Leadership Council on Early Years. But what it's doing is it's strengthened that existing childcare options at the community level. And it helps employees secure high quality childcare. It absolutely does. Employers are focusing on this. They are partnering with those local regulated childcare programs, and they are supporting the growth of childcare in every community. There are 2 cohorts that have been awarded these grants, and there is a wait list that we have been really working on in going through those who have applied for Partner Up. I want to just share a little bit more about how Partner Up works. So here's really the breakdown. We are working with Supporting Families Together Association, or SFTA, who I mentioned, working with our business childcare advocates. They are focusing on really setting up those contracts between businesses and childcare providers throughout the state. Employers are contributing between 25 and 50% of the tuition for the duration of the contract. And they're paying the true cost of childcare, which is really, really important. So for example, the true cost of childcare is roughly $1,800 for an infant and about $1,000 for 4 and 5-year-olds. And in between that for 2s and 3s. But that is the true cost of care, which is not what childcare providers are actually able to charge parents as tuition. DCF then matches the remaining between 50 and 75% with our Partner Up funds. And we're using an upgraded model. So primarily our American Rescue Plan Act dollars, as well as our CRSA dollars to match those funds. We are seeing employers really excited about this opportunity. And I just want to say a huge thank you to each and every one of you for sharing this information with those in your networks, in your industries. Over 220 businesses have received intent to award letters, and we have about 200 businesses that are right now actively engaged in Partner Up throughout the state. So you can see where those businesses are located in our 2 cohorts. It is so exciting. Again, the funding that we've been giving out is really based on that true cost of care, which is very important, that we're paying that amount, that the true cost, that it actually is to provide high quality care. So again, we'll talk a little bit more about the data, but so much is happening throughout the state. Again, thanks to each and every one of you, we have been able to look at so many industries that are participating in Partner Up. Here you can see the breakdown of what businesses are engaged in Partner Up. So healthcare, social services, construction, manufacturing, business services, food services, retail, real estate, agriculture, transportation, finance, and insurance. Those are the high level categories, and there's so many within there that you will see that really make up the businesses that are participating statewide in Partner Up. It's incredible. Again, we are working through our wait list. It's been just the excitement around Partner Up has been truly incredible. On the next slide, you'll see the impact that we have so far. There are currently 199, so almost 200 participating businesses, with another 20 that are really in the works here. We have secured, businesses have secured over 900 childcare slots across the state for their employees. That's an incredible amount. We know that we have the breakdown in terms of those who are participating, those people of color, as well as the average employee age, the income for the families, and families that were able to continue with their current childcare situation. So they've continued in their regulated provider, continuing that high quality support. Now, there's some work to be done? Yeah, we want to make sure that we are making this program accessible to all families across the state, and really looking at families of color, looking at the household income, and really being able to move the needle there. We want more businesses to participate. We want to increase those slots for our employees. It's really critical. But there's some great initial data that we have here. And again, you can see the impact that is happening across our state. On the next slide, there's been a lot of feedback, and you're going to hear more about this as folks share information from their perspectives. But I just want you to take a look at information from an employee and an employer. From the employee, they state, as far as Partner Up goes, we wouldn't be where we are without it, because a huge chunk of my income would be going to childcare if I decided to bring in any income at all. We've been renting our home, and within the next month, we'll be able to purchase our home. That certainly wouldn't have happened without the Partner Up program. We wouldn't have been able to get a mortgage loan with one income, but now we have two incomes. That's been huge. So again, you see the impact from the employee perspective on overall economic security, well-being, housing. We're connecting the dots here for our families. From the employer perspective, they say, we have staff who are incredibly grateful for this childcare funding and partnership. And it's also been incredible for local daycare centers. They've been able to actually invest in additional staff, opening more spots, and investing in their infrastructure a little bit. This grant has been an incredible opportunity for our staff and the community. So again, you see this from the employee and the employer perspective. I want to briefly touch on Dream Up, which is the other part of Project Growth, and talk a little bit about what this means for communities. Communities are focusing on really that strategic planning around childcare in their communities. They are looking to expand opportunities. They're looking at free training, business supports, leadership development, and stipends for engaging in working as a cohort. What we have to share, and this is great, is that there will be a next round of competitive applications that will come out specifically for Dream Up in early 2023. Dream Up communities, we're going to share a little bit more about those in the next slide, but they have been excited. Here's the awardees. As you can see, there have been a number of communities involved in our first and second cohorts. So 12 communities were awarded kicked off that work in early summer, late spring of this year. And our second cohort has started very recently. Again, we will be awarding another round of awardees in early 2023. But again, across the state, communities are interested in thinking about childcare and thinking about how they're connecting the dots within their community across so many different sectors that are supporting this work, including businesses. On the next slide, here's some emerging work that's happening with our Dream Up communities. So there's work that's happening on the planning end in terms of community and employer surveys and events to just learn more about what their community needs. They are building a childcare workforce to reopen classrooms that have been closed due to the lack of staffing. There's a big conversation around engaging high school students to become childcare providers and educators. There's work that's happening to support in-home providers and enhancing and growing their programs. So again, that expansion. They're preparing to open new childcare centers and looking at really some strategic partnerships in the community. And then looking at potential resources and asking for support from state and local leaders. So thinking about how they're going to sustain the work that they are engaging in the Dream Up award. So there's so much that's happening at the community level in terms of Dream Up. So once again, there's been so much work both with Partner Up and that business and the business supported childcare piece, as well as Dream Up, which is really focused on community support and engagement and really starting up in those activities that we described. So now we're at the point where we get to hear from a panel. I want to just take a moment to introduce some folks here. I do want to introduce, and many of you know Andrea Camilleri. She is going to lead this panel discussion, and she is our strategic initiatives advisor through our preschool development grant. But I also want to introduce a few others that have been recipients in our Partner Up grants and really are represent the major stakeholder groups that are involved in this program. So you're going to hear from Christy McCoyak, who is an employer and is committed to investing in childcare. She is seeing such a strong return on her investment in her Hillsborough in the southwest part of our state. You're also going to hear from Tina Tillman, who works for a childcare program in Appleton. And she has been able to provide all staff who need free childcare. And there are some parents of children in the program who she was actually able to recruit to come to work for her as a result of this grant. And then finally, you're going to hear from a parent, Lance Taylor, who is benefiting from free childcare in Waukesha, along with several other of his team members with whom he manages. So it's exciting. I'm so honored to have each of you here, and I'm going to turn this panel discussion over to Andrea Camilleri. Andrea.
All right, thank you so much, Erin. And I am going to stop sharing the screen for a moment so we can really see each other's faces and engage and interact in this discussion. So for our first question, I'm going to ask each of the panelists to tell us a little bit about when you first learned about Partner Up. What drove you to pursue the opportunity?
All right, can you hear me?
Yes, thank
Okay,
you, Christy.
This is Christy McCoik. I'm the administrator at Gunderson St. Joseph's Hospital and Clinics located in Vernon County. And when we saw this, my first reaction was, this is too good to be true. We are a hospital and 3 clinics. We employ approximately 200 people. And in our rural community, daycare is predominantly provided by in-home providers. And when the pandemic hit, we lost many of those. Either the income was too unstable due to illnesses and the impact on it on parents' jobs, but many of them chose that time to leave daycare. And we had a real issue. We obviously can't recruit and retain staff when we don't have childcare in our community. So it really came down to us thinking, how can we make childcare sustainable in our community? And when I saw the true cost of care, it was as it was calculated in this opportunity, we had to jump on it. We see it as a huge win for our staff, for our community, the economic stability of our community. A little bit later on, I'll talk about exactly how much money is coming into our small community, but it is significant, and it really allows these daycare providers to finally make needed investments on infrastructure, staffing, and programs. So for us, it's been, a win-win-win.
And I'm Tina Tillman. I'm the owner and administrator at Apple Tree Connections Early Learning Center in Appleton. And I will just piggyback on what Christy was saying is, as we applied as a childcare provider to partner up, my director had asked, well, what about us? We're an employer as well. Why can't we provide that to our team? We currently have already given them 50% off, but why not do more? And so we applied as well and received the grant as part of the first cohort. And it has changed the lives of so many of my team members. And as we mentioned previously, we actually put it out to our families to say, hey, if you're ever looking for making a change in your career, if you actually, your children are already here, but if you wanted to switch and work in childcare, you'd have free childcare versus paying full tuition for those parents. And we did hire a few of them already. So it's been very, very positive for us.
Hello, everybody. My name is Lance Taylor, coming live to you from Waukesha, Wisconsin. I am a parent of 3, 5, and younger. And when I first heard about this grant, it was just too good to be true. There's so many things that are hard in life. And when you read this, it almost read like spam. And it just seemed like, had it not come from my HR director, it's too good to be true. And just the impacts it has had on my family and my wife, and even my children has just been outstanding. And I'll get a little bit more into that as the questions continue.
Thank you so much, everyone, for being here. Once again, it's great to hear your real true stories and your voices. So question number 2 is really directed toward Christy and Tina as the employers in the group. Had you ever thought about pursuing a similar partnership before? And how did Partner Up facilitate or accelerate that process?
So I'll jump in first. We absolutely have always been looking for solutions for childcare in our rural community. And the models that we've seen usually require 100 children to be economically feasible. We're not going to have 100 children in a rural area, where parents have to drive quite a ways for daycare. So with this model, what's so appealing about this model is it lets those providers who are already in place, who are already regulated providers, be sustainable and not require us to reinvent the wheel and try to get all of them to come into one larger center with 100 children. That's just not going to happen in our rural areas. So this let us take what is currently in place and make that sustainable.
And I can also just add that several of my parents had in the past talked to me about maybe talking to their employers about having some type of partnership, but truly it wasn't something that they could afford. Those businesses couldn't afford to do that. And now I think, again, with this type of opportunity, you're seeing more and more of those businesses obviously take advantage of that when they are sharing that cost. It makes a huge difference for them.
Great. Okay, so here comes a big question for everyone. What has Partner Up done for you, your organization, and your community? And if you could share some stories about what others have said to you about it along the way, that would be great too.
Well, this is my favorite question because this is where we get to really tell the story of what's going on. So for us at Gunderson St. Joseph's, when we first saw this, we applied for 24 positions, 24 daycare slots. We had done a survey of our staff, and that seemed to be a good number for us. So we have 16 employees, 24 children across 5 providers in our rural area. And the really exciting thing is the grant is bringing in $233,000 to these 5 providers to make their centers sustainable. Gunderson St. Joe's puts in $77,000 over the year for a total of $311,000 coming into a rural community to sustain daycare. It's been a huge win for retention. Many of our employees, it allows them to continue working. We have staff members who all different kinds of occupations, whether it's a receptionist, one of our maintenance staff workers, nurses. It really lets them continue to work without the worry of how are we going to fund daycare? What are we going to do? Can we even find daycare? That's the other big thing. So for us, it's definitely a win-win-win. I think going forward, the other thing it lets us do is we've already got that 77,000 kind of earmarked. It lets us continue to support daycare. Now we've already figured out that if we put money in, the impact we can have. So it's helped us to kind of get our toe in the water, so to speak, of keeping daycare sustainable. And it also allows many of our employees to go back to school. I've got a couple of staff members who now they're in nursing school because they don't have the daycare costs. They can actually afford to make that investment in their own personal development and further their family's long-term goals.
I will just add as well that for our community and for our center, it has been amazing. I have team members who, again, they were getting a discount, but not to this degree. I had one that went on their first family vacation that they've ever gone on because of this. So it's really just exciting to see even the smaller things happening for people. People are saving money for a down payment for a home that they, again, probably couldn't have gotten there for years and years, if at all. So it's really just very, very powerful, I think, from a standpoint of going through a pandemic and seeing what that does to our workforce. I mean, our center, we had to reduce the number of children and number of staff, and then build it back up. It was difficult, and those families felt that pain. And now to have that type of support is really just truly life-changing.
And just as the parent, this has impacted so many, not just my family, but also, the place that I work at the Belter companies, as well as our daycare provider. So, I mean, as I kind of run through the story real quick of how this has impacted us, I'm going to pretty much be using we language because it's so many people are impacted. But just to throw it back to the day I first saw my wife, it was very much so a love at first sight. And I saw her, we're both in college going to become educators, and it was kind of education 101. And we, very quickly talked, and we went on a date. And that day we were talking about family. We just both kind of knew, which is very strange, but we moved forward. We're talking names. We knew we wanted that American dream, and we both wanted the same things. And that dream kind of started with, hey, let's graduate college. Neither of us, we're both the first people in our family to graduate. So we didn't have anybody to really pave the way. And we financially had to pay for college on our own. And, 12 years later, we are still paying for college. So after that, we fell deeper and deeper in love. We got married, costs associated with that. We then bought the house, we bought a car. Then after that came children, which is the best part of it all. The one thing that, we were aware of, but didn't really quite realize that the impacts were financially, how much it costs for us to continue working, how much that would cost. And so it's such a vulnerable piece, finding other people to raise your kids. So at first we did have kind of an okay solution that we weren't in love with. And honestly, in 2020, after we had our third child, my wife just realized that, the cost of daycare, an educator's salary did not cover the cost of daycare. For 3 kids, absolutely not. So she stayed home, and she was home for 2.5 years. And even being a wonderful educator, wonderful mother, there's just such an important aspect, that social aspect that our kids just can't get. I have 5, 3, and 1-year-old. They're just not meant to be spending all day together with each other. And it's very difficult to differentiate kind of the instruction amongst them. So for them to be able to go to daycare was just so important for them, so that they could stay ahead and just be, more aware of everything. So when we read this Partner Up grant, it was, like I said, too good to be true. And I brought it home to my wife, and I mean, there were seriously tears at our house. It was wild. And to have so many, just chasing that American dream, like I said, there's so many expenses along the way. And to have a relief, at least for even just this year that we've been granted, it's too good to be true. It's allowed my wife to rejoin the workforce and kind of pursue her own business, which has been a dream of hers. So to get that financial income, obviously, just creates such a wonderful relief. I mean, after buying our first small house in Milwaukee, after having 3 kids, 1 bathroom, 900 square feet is pretty rough. So the new house, that we were able to get, that adds costs too. So this, again, just allowed us to move into a nicer new house. It allows us to go on a vacation, which, I mean, if we have 3 kids, we're not going too far. So we're definitely staying in Wisconsin, probably going up north there. And as far as just being a manager of people who also qualify for the program. I mean, just what Christy brought up with retention is so important. We're very customer service driven. That's kind of an entry level position. So we have really high turnover, and it's been great just to know, like, people now have daycare for free for a year. Like, the way that their attitudes have shifted, knowing that, you know, not only this grant is awesome, but the employer has also invested in us, has just really shifted morale really quickly. We just got granted this, I think, roughly September, at least that's when I started. And it's shifted already in the right direction, which has just been a blessing for work. I personally, like, I've been happy at work, but I've always kept my LinkedIn like toggle of, like, you know, open to work. I'm interested, and I switched that over to not interested because I'm just very happy and lucky to be where I am. And I know it's a blessing to my colleagues as well. Just in speaking with my daycare provider, who we were able to keep, they just said that the program was very exciting. And they were excited to kind of learn about it. And as I've spoken to them, they've said it's gone really smoothly on their end. And, you know, it's just, they built a brand new building themselves over the last year. They were forced to relocate. So any additional funds that they're able to get has just been a blessing. So again, just thank you so much for the opportunity. It's such an honor to represent the parents who are impacted by this. I'm sure everybody has their own family sentiment to share, and it's too good to be true still, even as we're doing it. So thank you, everybody, for your hard work to make it happen.
Thank you, all of you. And Lance, I really hope that you're going to provide this recording to your wife and as a little love letter. Such kind words. Thank you. Question number 4 for all of you is to address what it will mean for you and your organization if Partner Up goes away. Have you made any plans for how you might address that challenge?
So, like I mentioned before, for Gunderson St. Joseph's, one thing this has done is helped us earmark some funds to continue sustainability efforts on our part. But, you know, it's going to take more than that. It's going to take, you know, we need to continue to look for ways to make daycare sustainable, make it affordable for daycare providers to operate in our rural area. And it'll go back to, we'll have some challenges again. I love what Lance says about how he changed his LinkedIn profile to not looking. That is our goal every day in our organization. And I know that this did this for our staff who are involved. And I'd like other employers to have that opportunity too, to be able to offer this to their staff. It's a fantastic program, and I hope it does continue.
And I will just add as well, if it doesn't go away, then we would go back to our 50% coverage for our team. But to Christy's point, there's more that's needed to help all of our families to be able to afford quality childcare. It's a difficult balance between how we can pay our employees and what we can charge our families. And it's a continuous challenge. So any support is very appreciated by, I'm sure, the families, as Len said, but all the employers and childcare centers appreciate the support more than you can ever imagine.
Yeah, I kind of mentioned that. I mean, if it goes away, my wife and I will have to have a very serious conversation about how to proceed. And I mean, now at this point, she's 2 months into a new career path, and it definitely throw a curveball. She might have to go back to staying at home with our 2 kids who would need childcare.
All right, so our final question today is, what would you say to other families, businesses, and childcare programs who are considering participation in a partner-up style arrangement? So not necessarily the grant itself, but could be looking to set this up on their own. Do you have any advice for any of them?
I think the first step that we took was doing a survey of our staff to find out exactly, you know, what are the daycare needs in your business? Because I think once you see that, it really is very eye-opening at what sort of battles and where are your families taking their children to daycare, and what can you do to support those daycares to make them sustainable? So I think you have to have we'd never done that before. We had never really tried to get our arms around exactly how many kids are in our workforce, so that we could try to help them. So that's been very eye-opening. So I think that's step number 1. And believe me, if there's another round of Partner Up, I'll be telling every single person, every business person that I know to take advantage of it. It's amazing.
Yeah, and I will just say again, from the Partner Up grant perspective, it has been very, very easy and smooth as an employer, as a childcare provider to do this. I know that it's a lot of work behind the scenes as slots might change, children go off to kindergarten and someone else takes a slot. It's a lot of work that's happening, but I'll tell you, the people that I've talked to have been amazing and just very, very hardworking and diligent and making sure everything is correct. It's been incredible. I think the biggest challenge that businesses may have is to be organized in this type of grant situation. And but beyond that, it is very, very smooth. Looking for other opportunities to support childcare centers and support those businesses along the way. Everyone should take advantage of that if they can. It's an amazing opportunity to partner.
Yeah, as Tina mentioned, it's a wonderful program. It's changing my family's life, and it's been very easy to navigate through from the employee side of things. And it was able to also open me up to the resources that are available that I didn't know of, just as far as finding quality instruction. I would highly recommend any employer to please apply for this. It's life-changing.
Thank you again so much for taking this time to share your experiences, get your thoughts together around this, and speaking up so that our Leadership Council can hear more about the real impact of this program. So we're delighted, we're gratified to hear that the program is affecting your lives and the lives of all of your staff in such positive ways. So before we head to break in about 4 minutes, I just want to check and see if anyone has any follow-up questions for any of the panelists. You can come off mute and go ahead and share your comment or question.
Alice, this is Linda Hall from the Office of Children's Mental Health. I don't have a question, but it's just so inspiring to hear these stories. And, you know, I keep learning things here at these meetings about all of the good work that's been done and the expansion that's been done for childcare to increase the number of childcare slots available. And yet, as I'm out talking to people in my community and across the state, it's just I know you all are working on this, but the message isn't getting out, and I don't know how we do that. But I think the stories about the childcare deserts just continue to predominate, and I just wish we had some other way of highlighting all the work that's been happening, and the work that these folks in the community have done. It's stepping out into a new world to do this kind of subsidy of childcare is it's not an easy thing. It takes courage to do that. So appreciate that you've done that. And I certainly hope that we can just continue to grow this.
Thank you, Linda. Yeah, we've been doing what we can to get the media involved and talk to people and gather these stories. This is our first preliminary data of the evaluation because we just started this program this spring. So there will be more coming. But yes, we appreciate your efforts to help get the word out as well. And just keep telling the stories. We'll continue this conversation throughout today as you hear from some more folks who've done other work in other communities through our grants and across the state in other separate ways. Does anyone have a last question or comment? If not, I thank you once again to our panelists. We appreciate you being here today, taking the time out of your busy lives. And Erin, I'll turn it back to you to see if you have any remarks before we go to break.
Yeah, I just want to say it warms my heart to hear these stories. When we initially talked about this program, it was right here with the folks on this call through the Leadership Council and early years in really wanting to connect the dots between businesses and employers, employees, parents, communities. And I mean, you were hearing stories of how this Partner Up in particular has impacted the lives of people. And these are a few stories of many that are shared, and they're powerful. They're absolutely powerful. Like, my heart is so, like, it just is like beaming right now with how excited I am about the work that you all have done in your communities. And I think that there's just a real opportunity to think about essentially diversifying revenue for our childcare industry. And that's a really important piece. That's what we're doing. The dollars that we have right now coming from the feds and then the state level are just not enough. We know that, and we know the true cost of care is really, it's a lot, and it should be a lot. It's important work that people are doing, and people should get compensated appropriately for doing what I argue one of the most important jobs in raising our young children in Wisconsin. And so it's not enough, and we're really thinking about how to diversify that revenue at the local level. And I think you guys have done amazing in investing in your staff and your communities. And I just want to say thank you for everything that you have done. So right now we are going to take a 10-minute break. We will come back at 10:05, and we are going to hear from another community and their work that they're doing in Dream Up. And then we are going to hear from Raising Wisconsin. So with that, we can sign off and come right back at 10:05. Thank you. Welcome back, everybody. We will give folks just a few more seconds to rejoin, and then we will get started. All right, welcome back. So at this time, we are going to hear about a community example that is going to showcase one of the many efforts that are underway across our state to truly engage multi-sector participants in community action around our childcare crisis in shortage. So now we have the greater Watertown area in Dodge and Jefferson counties who have been working for quite some time on this very issue. And they are on the verge of opening a new childcare center through area business partnerships. They also have plans for another, and they're investing in efforts to increase the childcare teacher pipeline. So there's a lot happening. While their work does predate the Dream Up grant, they have just finished their planning phase of Dream Up, and they are very soon going to begin spending grant funds to achieve their specific goals. I am excited to introduce and welcome Becky Gluen. She's the grant's core team lead, and she represents the Greater Watertown Community Health Foundation and is also the mayor of Beaver Dam. And she is joined by Erin Tronson of Madison College and one of her core team partners who has been testing out budgets and different models for high quality, affordable childcare that actually pays staff a living wage and includes benefits. So thank you for being here, Becky and Erin, and I'm going to turn it over to you.
Thank you. I'm not hearing Becky. Are you? Can you hear me?
I can hear you. I don't hear Becky either.
Testing.
There.
Here you go.
Okay, good. I thought we had that figured out, but hey, thank you so much for having us. Really appreciate it. I'll start out here with just giving some information background before I hand it over to Erin. But I want to thank you for the invitation to be here and to present. Really do appreciate it. I am here in two different roles. The first role is with the Greater Watertown Community Health Foundation, and I'm a community development strategist working with them, and as well with the mayor's position, working with the city of Beaver Dam. I've been a full-time mayor for the last 6 years, about 6 years. Just recently, within the last month or so, we hired a city administrator. So it allows me to take on another role with the foundation like this. And so when I was looking for another position, this really popped up to me because they were really focused on Dodge and Jefferson counties, which are my communities and areas, but also that they were focusing on childcare and housing, which is something that I've been working on as mayor as well. So it was kind of a dual way to look at those things. So just as background for the Greater Watertown Community Health Foundation was founded in 2015. It was a first venture transaction. So it was the first in Wisconsin where a hospital changed from a nonprofit to a for-profit hospital. At the time, it was Watertown Regional Medical Center, and it was purchased by LifePoint Health. So the foundation began with a large endowment, and as part of the sale agreement maintains 20% ownership in the hospital. The foundation's an independent nonprofit public charity that's governed by a board of directors. If we can go on to the next slide. When the foundation was formed in 2015, they spent a year planning, completing surveys, interviewing leaders in the region about the needs of the area. And so then it was determined that focusing on early childhood development was critical to improving health outcomes in the region. Through their work, the foundation determined that the work would focus on building strong families, assuring that all children are ready for kindergarten and that all children will have school success. If you go on to the next slide. So in order to reach those goals, the foundation understood that they would need to engage community partners and area partners. So they established relationships across the region, bringing people together to work toward those common goals and looking at who were the individuals already working kind of in that vein, as well as who were the leaders or who are the leaders, were the leaders in the area. The foundation has a critical role in this by being the facilitation group. So they schedule, plan, follow up with stakeholders to make sure actionable items are actually being acted on. We're continually able to help everyone move any issue forward, so thereby moving the needle on the subject. I've seen this work in my own work over the years with either coordinating volunteer activities, coalition building, and as mayor, where the leadership role is critical in that facilitator bringing impactful change and continuing to move issues forward. If we can move that advance, please, to the next slide. The foundation uses the collective impact model as an approach that brings people together in a structured way to achieve social change, and it starts with a common agenda. They establish shared measurement, foster mutually reinforcing activities, encourage continuous communication. The principles of practice are designing and implementing the initiative with a priority placed on equity, include community members in the collaborative, recruit and co-create with cross-sector partners, use data to continuously learn, adapt, and improve, cultivate leaders with unique system leadership skills, focus on program and system changes, build a culture that fosters relationships, trust, and respect across participants. Moving on to the next slide. As a part of my leadership role with the foundation, we submitted and received the Dream Up grant through DCF and Children's First Financial. Our Dream Up work has focused on bringing some of those same foundation partners already working together and my partners from Dodge County to the table as well. We've had over 25 stakeholders that are meeting monthly as a part of our Dream Up grant to try and design solutions to the childcare crisis. This work has led us to form 2 committee groups focused on initiating solutions and developing LCEY teachers and partnering with area businesses to determine what the gap is for childcare, how much should families actually be paying, and is the employer willing to help with closing that gap. We have 2 initiatives that are as far as trying to set up with businesses and then also our pipeline area. We've learned through the process that the childcare industry as a whole is stressed out and threadbare. I think we've heard that this morning, that the burden on parents to carry the costs is too much and is affecting parents' decisions on whether they stay in the workforce or they drop out. So we have businesses at the table working with us to determine what financial formula would work for their business, starting with 2 pipeline projects, one in Watertown initiative with the YMCA that Andrea talked about, where we'll create 126 childcare slots. We have public schools, tech schools, economic development working together on how we can develop the ECE workforce. A few of our initiatives are to create a boot camp for high school students during spring break week with initial learning to become an EC educator. Working with the tech college instructors to team up with high schools and provide early education classes at the high school for rural communities that don't have teachers that have the ability or the time built into their schedules to be able to provide those classes, as well as advertising the ECE field as a rewarding career, pay and benefits that are shifting, and a career that you can make a difference in the lives of children and your community. We'll also support WESN to provide coaching to develop 2 pilot family care projects, and that's part of the Dream Up as well. The tech schools, and we're working with Madison College and Moraine Park Technical College, and they bring a lot of expertise where they offer partnerships that they have formed, and Erin will talk more about that, but also provide free foundational courses in English and Spanish, and that's something that Erin's been instrumental in. If we could move to the next slide. As a Dream Up grant recipient, we understand it's important. In fact, I feel it's critical. It's critically important that we have a component of our efforts that include advocacy for the field of education as well as for childcare counts funding. We know Raising Wisconsin's already doing an incredible job in this area, so we made a decision to partner with Raising Wisconsin to fund participation with them for lobbying. And so that we have a voice, but we also partnered with them to hold a legislative forum with Mark Bourne. If you're familiar with Mark, Mark is an assemblyman and he's on the Joint Finance Committee. So Mark and I work together because he's my representative and I'm the mayor. So I do have a close relationship with him, which has been nice to work with. And so we were able to get him to come to a listening session along with State Senator John Jagler. And the session was incredibly successful. We had over 70 stakeholders in attendance, very powerful conversation from everyone in attendance. And I think the thing that everybody walked away from were the business leaders that were there and could share as well in talking about how this is impacting their workforce, and that they were in support of however how we can take this forward. But they were all and every conversation I've had with business leaders as well in support of continuing childcare counts. So we'll continue to look to Raising Wisconsin and how we can partner with them to share on additional advocacy opportunities. And that's a part of what we're working with our stakeholders and the Dream Up grant as well. So I'll introduce Erin Tronson, and she works with Madison College, and she is an esteemed community partner with us. She's been fantastic to work with. We're so grateful. And she is, let's see, an early childhood project manager with Madison College, right? Go ahead, Erin.
Yes. Good morning, everyone. I'm thrilled to be here. It has been incredibly rewarding to work with Becky and the Watertown Community Health Foundation. Just a little bit of background before I dive into that work. When we started partnering with Becky and the Health Foundation, Madison College had already kind of focused in on our own district-wide childcare roadmap, of which there are many partners involved, including many of the folks that are in this room today. And so as part of that work, which is in part funded by the Wisconsin Workforce Innovation Grant, We also developed 5 specific goals. If you could advance to the next slide, that would be great. And our 5 goals aligned very carefully or very well with Becky's Dream Up grant. And so it was quite exciting to come in at this point when we were also looking at increasing childcare access and developing childcare professionals. Now, Watertown is one of Madison College's regional campuses. And so we have been interested in a while in partnering to figure out how to support our parenting students there, how to support the Watertown community. And so it was just a great match. And it was also quite impressive how much work had already been done in Watertown as far as getting this focus together and Becky kind of getting the right people in the room. So when I started joining meetings, I was assigned, they had their 2 different groups. They have increasing the teacher pipeline, and then they also have the partnership with businesses. And I joined that group. If you could advance to the next slide, please. And what was so exciting about that group is someone who has worked in early childhood education for 25 years at this point, was to see the business representation at that table. That was what was really unique about this Watertown group, is that there were businesses at the table. And not only were they just at the table learning about it, but the businesses that were there already knew the nuances of the industry. They already knew about childcare deserts. They already knew that the staff had been underpaid, and that's why we were losing childcare providers at this like incredible rate. And they also knew that it was impacting their workforce. They also knew that they were struggling because they did not have childcare for their employees. And so that was an exciting place to start. And so this group of people decided to think about like, well, let's imagine, this is a Dream Up grant. Let's imagine what this could look like with all that we know and all of these people in the room. So if you could advance to the next slide, we started fantasizing about this financial ecosystem, right? We really started understanding the real cost of care. And what we wanted to keep at the center of this dream was a livable wage for early childhood education workers. That was very important to this group, including things like health insurance, but we also didn't want to let go of quality. And we also wanted to make sure that everyone was educated, trained, and that the center was licensed and accredited, and that it was affordable to the families, right? An impossible task. And consistency. We had talked a lot about how centers kept closing, or classrooms were closing, or teachers were turning over. So how could we kind of put things in place so this was a sustainable dream as well? So if you could go to the next slide, that would be great. And as I already mentioned, it was unique that Watertown already had these businesses who were interested in being part of finding solutions to the childcare crisis. And so, so what we did is one of the members of this business partnership group had a business who was already interested and ready to like invest in a solution, meaning investing financially, not just by showing up to the meeting. So we started to just imagine a center kind of around this person's, the business that this person came from. And so, and really developed a kind of a budget and a model to move forward with. So if you could go to the next slide. And we really realized that if we wanted to keep at the center all of those values that we had about supporting the ECE worker and keeping high quality care, this was going to have to be a multi-layered initiative, a true coalition. Childcare cannot support themselves budget-wise on their own, and there's going to have to be multiple layers to this. So we started, or at least I started talking about it as like a cake. I'm like, it's like a multi-layered cake. And these 3 layers are there having an employer contribution to the budget, having a family contribution, as we've always had, to the budget, and then also sustaining this government, this child care counts funding indefinitely to really have this healthy early childhood center. Next slide, please. So the fictitious center that we kind of dreamed up had about, and it was kind of designed around this person's business, has these kind of demographics to it. So about 84 children, some just kind of, we were already honing in and kind of focusing in on a space that was possibly coming available in the community. And so we started knowing where we were coming from. So there's some actual pieces that were coming to play in here as we were dreaming up this center. Next slide, please. And this is just to show, I have 20 years of operating and directing an early childhood center here in Madison of over 100 students. So I've had lots of experience and lots of budget exercises. So I was excited to develop this budget with this idea of this multi-layered system. So this slide is just to show you the complexities and the many items that go into developing and operating a childcare center. Next slide, please. And then we did, of course, keep at the center of our plan these sustainable wages. And as you can see here, still no one is going to be getting rich off of being an early childhood provider, but these wages are far above what folks are being paid today. This is such a beloved career that the only reason people are leaving it is because they have to. The rate and the wage they are being paid is not sustaining themselves or their families. And so even getting up to kind of these kind of wages would make such a significant difference in our field. Next slide, please. So for our imagined center, this was kind of the breakdown. I don't want us to get too hooked onto these numbers because they've already changed and morphed. And I know Becky has continued to do more work with the business partner, but at that time, this is kind of what we were looking at. That employer we were working with said, I know that this company will give at least $300 per employee child, at least. So let's start there. We kind of averaged out what child care counts funding was given with both the retention piece as well as the supporting child piece, and kind of came up with that amount, and then what the family contribution would be. And then, as we already heard from the other Aaron earlier this morning, this definitely kind of echoes that true cost of care that was coming in, and this is in Watertown, somewhere between $1,500 and $1,700 a month. If we really wanted to keep high wages, which is what's going to attract people to this career and keep people in this career. Next slide, please. It's worth mentioning that this is still far. This model isn't going to work for every community and every center. We've heard from the U.S. Department of Health and Human Services that the goal is really that no household would pay more than 7% of their income towards childcare. So if that were the case, and we're talking about our Imagine Center, those households would have to make $120,000 a year. And that's not always going to be realistic either, especially since I just checked the US Census yesterday, and 70,000 is about the real median of household income right now. So to the last slide, if you could advance to the next one, thank you. I always kind of like to mention that this cake is going to look different for different communities and different centers, and that this is just one idea of having these 3 different layers, but there are certainly other models, other partnerships, other financial configurations that could take some of the burden off of families who are paying too much and off the shoulders of providers who are getting paid too little. And there has to be more entities in this mix if it's going to be sustainable. So some other ideas could be different kinds of breakdowns. The employer could be giving more per month than the family. You could vary that to keep it to 7% to each family, or a complete different model or dessert altogether. Maybe it's just government-sponsored healthcare. Even if everyone who worked at an early childhood center knew that they were going to be able to have benefits, it would change the industry. I just can't even tell you how much it would change the industry. So before I hand it back over to Becky, I do want to again just underline the importance of continued childcare accounts funding. I can't get into a room without underlining the importance of that. And as a director who was still in that role for when that funding came into place, I have to mention something that doesn't always get brought up. Because we have managed budgets in early childhood centers from such a scarcity mindset for so very, very long, we need to know that that funding is secure and going to be in place so that we can give substantial raises to our teachers. It is too scary. We are giving big bonuses and we are fixing things in our centers that have long needed to be fixed with that funding. But if you want to see it really support the workers, we need to know that we can count on it. So it's not going to be like that, that Lance who was saying like how wonderful it is to have this 1 year be granted. We need to kind of know that this is going to continue so that we can honor these teachers in a way that we can promise them is going to continue to follow their career and not just be a 1 year or 2 year support. So in conclusion, we really need to think of childcare budgets as a layered cake. We in that advocacy session that Becky hosted, I heard over and over again this great phrase that said, the childcare is the workforce of the workforce, which means we all need to be at the table. We need to have sustainable wages for providers and high quality early childhood education and affordable tuition for families. We should not budge on any of those things. And in order for those three things to happen, families need to contribute, employers need to contribute, and the government needs to contribute as well. With that, I'm going to turn it back over to Becky, and I really appreciate being able to participate in this conversation today. Thanks for having me.
Thanks, Erin, and just thank you to everyone again for having us today. I will try to keep us or try to catch us up a little bit on schedule and just hand it back over to Erin for you to move us in the next direction.
Thank you so much, Becky and Erin. I love the work that Watertown is doing, and the cake analogy, that layered cake analogy really resonates so much. And in thinking about our funding model, what we have available, thinking about it from historically the scarcity perspective in how we really need to diversify our revenue at that local level so that we can do all of those amazing things that you mentioned, including thinking about pay parity, high quality programs, thinking about parent tuition, thinking about community investment, support, and sustainability. I could go on and on. So thank you for joining us, Becky and Erin. I'm going to transition us now to our next panel, our next group here. We have Wisconsin Early Childhood Association, or WECA, with us. So WECA has done a lot of work in this space for years and years. And in fact, their advocacy arm, Raising Wisconsin, has emerged from their work known as the Wisconsin Infantile Policy Project, which came out of our Pritzker Children's Initiative grant. So again, their advocacy arm, now known as Raising Wisconsin, has been referenced a number of times during this conversation. You will see handouts that are attached to the meeting invite, showcasing some of their work, but you're going to have the opportunity to hear from WECA's Executive Director, Ruth Schmidt, as well as the Raising Wisconsin Director, Jackie Anderson. So I'm going to turn it over now to Ruth and Jackie. Thank you.
Thanks, Erin. And Jackie, if you want to go ahead and start the slide deck, I'll just start talking. So I'm Ruth Schmidt. I'm the Executive Director here at Wisconsin Early Childhood Association. I've been with the organization for a little over 20 years now and have become really passionate as an advocate for what we do in the world of early care and education in Wisconsin. Before we dig into talking about Raising Wisconsin and the advocacy sort of branch of what our association does, I want to just say a few things about who we are as a company. We're the state affiliate of the National Association for the Education of Young Children. We provide significant, excuse me, I'm dealing with a little bit of cold. We provide significant services to people who work in the field of early care and education. We employ about 100 staff across the state of Wisconsin. And the services that we provide range from the Teacher Early Childhood Scholarship Program, the Reward Stipend Program. We are the state sponsor of the Child and Adult Care Food Program for family child care homes. We also then recently launched within the last several years, the Wisconsin Early Education Shared Services Network, which you've heard little bits about that. That's WESN. It's come up a couple times in today's conversation. And then we moved into Raising Wisconsin as a way to sort of really focus and hone in on the fact that childcare, you've heard this again, different types of ways we talk about it, but it is the workforce behind Wisconsin's workforce. Without a strong infrastructure of early care and education, our state cannot work, our economy will struggle, our communities will not be livable and viable places to recruit and retain young families, all of which is concerning, I think, to all of us today in this meeting together. I'm going to pass it on to Jackie Anderson to talk about Raising Wisconsin, this new initiative that we started leading about 3 years ago. And then I'll be jumping back in throughout this conversation to talk more about the work that we are doing, specifically engaging business leaders across the state of Wisconsin. Jackie?
Thanks, Ruth. I also have a little bit of a cold, so there's clearly lots of bugs going around. So I just want to thank everybody on the call, and really a shout out to Becky and Aaron. That event that we had a few weeks ago in Beaver Dam was just amazing and a true testament of what can happen when communities come together and engage businesses and legislators in one conversation. So it was really a fantastic opportunity. So I am going to give you a pretty high level overview of Raising Wisconsin and a little bit about the history of where we've come from. So as Ruth alluded to, we received a Pritzker Children's Initiative grant in 2019, and we were lucky enough to be a part of coalitions within 20 different states, all working together and really thinking about how do we support our families to ensure that they receive high quality services and increase our numbers by at least 50% by 2025. So this is a big, audacious goal. I'm happy to tell you that we have already reached that goal as part of Pritzker's Children's Initiative, and we've actually exceeded our goal up to this point, which is really exciting. So in 2019, we received this fund. We had a group come together and decide and really think through and assess what three main goals do we need to factor in when we're thinking about what it takes to ensure that all Wisconsin infants and toddlers and their families are receiving the quality care that they need. And we came up with these three goals. The first one is focusing in on ensuring that all families have access to high quality care. The second one is really ensuring that our staff ensure that they have the funding that they receive the training, and that they're really supported in a way that they deserve. And then the third one is really thinking about how do we ensure that our infants and toddlers and their families are also focusing in on health and well-being. So how do we ensure that they receive those supports? So we had these three main goals. The order is slightly different than what's on this slide. And we had lots and lots of different deliverables. And what we realized was that we really needed to hone in on what is most important and really create a vision so that everyone, all of our different coalition members, can see themselves as part of our work. So with that, we launched in just April of this year, so relatively new, Raising Wisconsin. So our vision for Raising Wisconsin is that we believe in a Wisconsin where children and families have the social, emotional, and economic supports they need to thrive. And together we will advocate for a Wisconsin where the health, safety, and optimal development of our children is an unwavering priority, the foundation of a promising future. So this vision is really what we are grounded in. So this is what we reference a lot when we're out talking, because it is all of those goals all lumped into one concise vision that people can get behind, organizations can get behind, families can get behind, because they can see themselves in that language. So part of all of this work, we really need to take a step back and think about, how did this all happen? Well, this all happened with an amazing state collaborative team that is more than 50 different organizations who have all signed on in 2019, and that coalition is actually increasing as we speak. And they all signed on to really get behind those three main goals and now our vision of Raising Wisconsin. What's important is that if you look at this screen, you'll see that it's not just early childhood experts, but it's organizations and companies who all believe and understand the importance that they play in ensuring that our Wisconsin infants and toddlers are supported and our ECE workforce is supported in a way that makes the most sense. So through the state collaborative team, we have supports in two different areas. So we have a childcare, what we call an advisory work group, and then we also have a optimal health and well-being work group. So these work groups consist of experts within, within the state. So WICA it's not our lane necessarily to really focus in on optimal health and well-being, but we ensure that we have some really, really amazing partners to help help us to really hone in on what is most important. So you'll see on the bottom that we also really encourage and are organizing many different advocates. So we have employers and business leaders, which Becky shared a great example of what happened in Beaver Dam. We have parents who are advocating on behalf of childcare and optimal health and well-being. And then we also have ECE providers who are also advocating. So our role at Raising Wisconsin is to have a collective voice to ensure that we're all advocating on behalf of the same message. And I'll share our message and our budget ask a little bit later. So one of the ways that we are engaging parents, this is something that is new to WICA, new to Raising Wisconsin, is through some outside funding to really advocate and organize our parents. Because last budget season, we heard loud and clear from legislators that weren't hearing from business leaders and they weren't hearing from parents. And we knew that the parents had stories. They had really provocative stories that needed to be shared. So with that, we've been able to organize and recruit 5 different parent leads right now who are actively engaging parents in their communities to be able to tell their story when we are getting ready for our budget season. So tonight, I'm super excited that we're going to be launching our first training for those parents who are all being organized. And the training tonight is called The Power of Parents. And it's really just reiterating to parents that their voice makes a difference and connecting their voice and their stories to how a budget ask will actually happen. So we're really excited about this. These parent leads are amazing. They're, you know, a lot of them are working moms, but they are passionate and they're making time for this because they understand the importance of sharing their stories. And with that, I'll turn it over to Ruth to talk a little bit about our Business Advisory Council.
Great, thanks, Jackie. So as part of the work that we've been doing and really trying to dive deeply into the world of engagement and advocacy work, we realized in conversations with legislators and with other organizations, this critical need for having a business voice at the table, speaking from one sort of platform in terms of what we really need for the early care and education industry in Wisconsin, what our communities need. And this all started pre-COVID. So all of these pieces we put into place right before COVID was sort of starting and sweeping our country. And I think what we've seen since then with the influx of federal dollars into our state, we have counties with federal dollars now through their local ARPA recovery funds. We've got municipalities with dollars. We've got ARPA funding coming in and tons of ability to stand up childcare infrastructure in our state right now, right? And you can find people in all 72 counties of Wisconsin doing really critical work as leaders to address childcare needs. One of the concerns I think that stems from all of this activity that is going on in our state is how do we stay streamlined on what we prioritize as budget asks and what we need to see the state do to ensure that there's ongoing support for this industry in our state. So we started with Business Advisory Council. You can see what we've listed here is the organizations, but in many of these cases, it's really powerful folks from these organizations who are part of this Business Advisory Council. They've been meeting with us quarterly since early 2020 and have been digging deeply into understanding childcare, understanding the challenges of what is happening, why childcare right now is a failed business model, why it does not operate effectively in a free market sort of condition, and really building an understanding that parents can't fix this, and that businesses can't fix this alone, and that there is this need for, whether you want to call it a 3-layer cake or whether you want to call it a 3-legged stool, we need to have a third partner in what is happening in childcare in our state. This group of individuals came together, has been meeting with us, has been pushing us to think about how do we go about engaging in broader and broader ways in communities across our state, employers, economic development people, workforce development people, so that we are sure that there is an undercurrent of consistency in what we are all sort of talking about when we think about solutions in childcare. Next. And so some of this you just heard about as Becky was talking about what was happening in Beaver Dam. We started a series of employer legislator forums that have been hosted over the course of the last 12 to 18 months. They have taken place in most recently Beaver Dam, Wausau, Eau Claire, Oconto Falls, Manitowoc, Pewaukee, St. Croix Falls, and Platteville. And you can sort of sense a theme in this. We're targeting key districts where we know we have strong legislators who have a critical voice in what is going to happen with state budget and state priorities. And so these are the areas that we have been targeting to have these employer legislative forums. And I think what's been fascinating about these is what we've seen happening is these serve as education opportunities, both for businesses to get a stronger sense of what is happening in childcare. So we always are sure that we have 1 or 2 childcare programs participating to be able to speak from the experience of why childcare is a failed business, why they can't raise wages higher than $9 to $13 an hour in our state, why we have childcare deserts. And it's an opportunity, I think, for businesses and legislators together to hear about that, and then for legislators to hear very clearly from business perspective, this is impacting our bottom line. We can't hire people. We have jobs open for over 3 months on average. We don't have livable communities anymore. Our schools are losing populations because parents have to go wherever they can find childcare for their children. We need to keep it in our community. The impact of childcare, I like to say childcare can almost always be a solution to just about any challenge that we have within the state of Wisconsin, because so much of it bases on the economic impact of what childcare can do if it is done well and if it stands up this infrastructure of parents being able to work, businesses being able to thrive. So we've done this series of legislative forums with business leaders. And now, again, at the sort of as our Business Advisory Council has called for us to do, we are launching a series of webinars. The first one, Jackie, if you want to go to the next slide. The first webinar is happening actually today, later this afternoon. Hopefully you've all seen this information. If not, I don't know, Jackie, if you can put it in the chat box in terms of its last minute registration, but you can still register. And it'll be streamed live again on Raising Wisconsin. We'll have that available in an archived way for people to come back to it. So the first of the 3 webinars that we're doing is what's the economy got to do with it? The business case for a state investment in early childhood in Wisconsin. This will be happening this afternoon. We are bringing together 4 CEOs. The moderator will be the CEO of Seven Rivers Alliance, a regional economic development authority in the state of Wisconsin and in areas of Iowa and Minnesota. So that's Chris Hardy. He will be facilitating a panel, including Dan Rohrbach, the CEO of Southwest Health, Paul Scharfman, the president of Specialty Cheeses, and Sachin Shivaram, who is the CEO of Wisconsin Aluminum Foundry. All of these gentlemen will be talking about how childcare is impacting their workforce and calling for a broad state investment into ongoing funding for childcare as we face this enormous fiscal cliff when our ARPA funding runs out in January of 2024. The next event will be happening post-election. Likely look for this information to be coming sometime in December. It'll be an election debrief, and we'll be talking about the impact on childcare priorities and how do we do grouping and regrouping and continuation of our call for this broad investment. And then the third will be an employer call to action, hopefully in January, which will be about assembling a broad coalition of business leaders to build on what we've done with our Business Advisory Council to keep this call and this demand for state investment into childcare moving forward.
Thanks, Ruth. So you can see and hear that Raising Wisconsin has been created as a way to gather our coalitions together and give a landing place for lots of opportunity to really talk to legislators and to advocate within our own communities. So our Raising Wisconsin website, I just wanted to point out some key pieces that are really important for you all within your departments to share, to think about if you're out and about within your communities. There's lots of amazing collateral on here that helps to tell the story. So for example, you can see the screen on the very bottom, there's collateral that you can use that really talks about the broken business model, because oftentimes when we're out and about, business leaders will say, well, childcare is so expensive. I don't understand why directors would need more money. Like, I don't really get it. And this is a piece of collateral that really breaks it down. Very similar to what Aaron was talking about earlier. It really breaks down what the true cost of care actually is, because we want our providers to feel supported and to be supported in a way that they can be successful. We also have various toolkits for our employers and our economic leaders, for early childhood professionals, community leaders, and families. And we did that because we know that advocacy is not innate in every single person who comes to this Raising Wisconsin website. So we wanted to ensure that they have the resources and tools to really feel like they have the confidence and the knowledge and the data to be able to support whether they're reaching out to a legislator, whether they're talking to a business, so that they really feel confident in their advocacy efforts. We also have a really important policy agenda and progress section, and we have a brand new tab. It's about a week old that is called our state budget requests. So when you click on our state budget requests, you're going to see that there are two main Raising Wisconsin budget asks that we're advocating for. The first is a $300 million state investment to ensure ongoing funding for childcare counts. Aaron did a really great example and shared the importance of childcare counts in our ECE programs. And it's important knowing that we have a fiscal cliff coming up in January of 2024, that we have strong childcare counts funding to be able to keep our early childhood programs open. We also are advocating on behalf of $5 million for children's mental health, $5 million for an expansion of Family Foundation's home visiting programs, and then extending Medicaid coverage in the postpartum period so birthing people can maintain coverage for 12 months after the birth of a new baby. So these Raising Wisconsin Health and Wellbeing budget asks have been through the lots of conversations within our Health and Wellbeing Advisory Work Group, and we have decided that these are the most important to ensure that our families are supported in a way that makes the most sense to them. In addition to that new tab that I talked about that has our state budget ask, we currently have a white paper on the importance of childcare counts and all the data behind why an investment is so desperately needed to support childcare. And we are in progress, typing away feverishly as I'm talking, to start working on a mental health one-pager as well. So we will be building collateral out to be able to support our different budget asks. So with that, I just want to reiterate one more time that we have created Raising Wisconsin as a vehicle to really be strong advocates on behalf of early childhood providers and families. And we hope that you within your departments, organizations, that you are using our materials and that we all can have a collective voice that is really advocating on behalf of a strong early childhood throughout the state of Wisconsin. And Ruth, I don't know if there's anything else that you want to mention.
So some of the things that I think are just worth, just so you know the scope of what we're trying to do, we work with two contract lobby firms in Wisconsin, Hamilton Consulting and HWZ, and they help to connect us really broadly with other large organizations and associations. So we have a meeting coming up next week with WMC. We had a meeting just recently with the Hotels and Lodging Association. We have a meeting coming up with the Restaurants Association. So this is all about the fact that this is an issue that is hitting the bottom line of every industry in our state. And so just know that the work we're doing is to be out connecting with businesses, getting them engaged. Obviously, there's a ton happening in Wisconsin that was brought up today in this meeting with Partner Up, with Dream Up. And all of this, my hope is we can rally and sort of stay united around a statewide ask and a statewide effort as we head into the budget session. It's important to know, and I like to share this fact with people, the state of Wisconsin right now puts $16 million into childcare out of state revenue. That is the bare minimum we need to draw down our federal match. And so we think that we can do significantly better. And we think this is the year to make it happen. So we'll be looking for that. We think that Raising Wisconsin has tons of resources for advocates, for business leaders, parents to engage, and we're super jazzed to be doing this work.
Thank you.
And Missy, yes, sorry, I just noticed the question Missy had in the chat box. Yes, the call will be recorded, and then we'll also post that on the Raising Wisconsin website.
Perfect. I was just going to ask that question, so that's perfect. So thank you so much, Ruth and Jackie. You know, I totally agree. Childcare is the workforce behind the workforce, and it could solve almost any problem. I think that's absolutely spot on. So I want to thank you, and thank you to all of our panelists for just sharing, you know, the work that they've been doing in their communities, in their regions, and statewide. We do have just a few minutes for any questions for any of the presenters today. Questions or comments? Peter.
Thank you to all the presenters, and I'm just incredibly impressed with the business coalitions and the advisory groups that have been put together. I just think this is remarkable and just so important in our march to try to get better equity and better outcomes in early childhood education. I guess my last question would just be next steps, because obviously I think this is going to be very important as we move forward. So how do we build upon that? What steps can we all take to help you with that effort, and what other things are you looking to accomplish in that regard?
Interestingly, that was a question I actually have for the council members. I mean, you've heard about such great, like, this is the foundation that we've been talking about. We're building it and doing some really, really great work with businesses, communities, you name it. How could the various departments add to the success of these opportunities? What do you see as next steps?
Well, I mean, one thing I'll say is during our call here, I had emailed our Badger unit head, which is business development, government relations, to say, let's add this to the website, all this information, you know, go to DCF, see what you can find there. I've got the contact names, we can follow up, and let's make sure we at least make this available. We go around the state, you know, really 2-3 times a month to various communities, and we're presenting to business groups. Now, obviously, our value is mainly economic information because, you know, we're talking about the state's revenues, and we're talking about where the economy is going, what we're projecting. And obviously, we have a lot of good news to share about the big surplus that we have, and that at least in Wisconsin, while the national economy is maybe doing so, we're doing extremely well. But, you know, we certainly, if you wanted to provide us with 4 or 5 slides that you think would be the most poignant, so that you're guiding us, so that we're making sure that we're bringing forward the best information, we would welcome that, and we would certainly use it. I'll be in Green Bay on Monday, and, you know, we could maybe even move that quick. I don't know. Otherwise, we're Mayor, we're supposed to be in Beaver Dam the following week. So, you know, hopefully we can bring something forward about your great work.
Hey, Peter, this is Emily, and I'll give just a really tangible example. I know many of us cabinet secretaries have been out on the road a lot lately, and one of the things I've gotten in the habit of doing before I speak to a group is I check that awesome slide that Jackie and Ruth shared to see membership, and if the group I'm speaking to is a member, and guess what, they usually are, then I thank them for their, I thank them for their affiliation. I thank them for, even if I'm not talking about childcare that day, I just say, hey, I noticed you're a member of Raising Wisconsin. That means a lot to our collective effort to really address this childcare issue in the state. So that's just one tangible, concrete, easy thing that I think we could all be doing.
Terrific. Well, that's good. We could certainly do that. And if you've got 2 or 3 others in particular you want us to highlight, I know that one thing that really strikes people when we're speaking is I use that statistic that you've talked about before, Secretary Amundsen, in terms of that we actually have more child care slots now than we had pre-pandemic. I think people are shocked to hear that. It's a great statistic. Of course, obviously, we still have a long way to go. And I make that clear too. It's not like we have problem solved, but at least knowing that children and families have brought in grants and are doing these creative things, I think really, makes people heartened to know that.
Thank you. And as you will see too in the chat, Andrea did put a link to the media bundle in Project Growth as well. So that's another just opportunity to share with your comms folks as well. Yes, Secretary Pachek.
Hi, Erin. I just wanted to add, I know we have like 1 minute left, and you referenced at the top of the meeting the Quest grant that DWD obtained in partnership with DCF. And I just really wanted to put another plug because in terms of next steps, this subsidized care and additional funding for expansion of Project Growth and Partner Up is expected to add another 500 childcare slots in some of those deserts that DCF has identified. It's also going to provide navigators that will help folks who want to start childcare businesses go through the application process and help with some of those regulatory issues that can be difficult to navigate, and is also going to provide some educational outreach to businesses. So we are really excited that this additional funding of $15 million is going to help support all of these great efforts that we've been talking about today. So just had to kind of end with some good news. And in terms of next steps, we think that's going to have an amazing impact for the childcare workers here and for the families in the state of Wisconsin.
All right, thank you. So there are some resources as well that are being put in the chat. These are all just really helpful. A couple of things before we wrap up. We will be sending out, we're looking at schedules for 2023. So looking at calendars, and we'll be in touch with meeting dates for the next year. And again, I just want to thank you all for being here, the presenters and panelists, as well as council members. This is something that you have seen from start now to where we are in terms of developing Project Growth, both Partner Up and Dream Up, and the work that's happening in the communities. So thank you for your just ongoing support, commitment to your children and families, and hard work that you've done in this area. And I do have to ask for a motion to adjourn.
So moved.
Seconded.
So thank you, Secretary Barca. And who was the second?
Secretary Carr.
Secretary Carr. Okay, thank you. All right. Thank you so much for joining today. Have a great day, and we'll be in touch in the near future. Take care. Bye-bye.
Nice job, everyone.